I love that. So I can explain it. Okay, so sometimes you don't have to be pregnant to get it, but most women, when they're pregnant, get it.
Mm-hmm.
You have your rectus abdominis, which is your six-pack muscle.
Mm-hmm.
It's connected by some connective tissue called the linea alba, and as you were pregnant, it stretched to accommodate the baby, right?
Yeah.
And so when it separates a little bit, it's not like a separation, it's just the tension of that connective tissue that kind of gets compromised.
Okay.
Sometimes it doesn't go back all the way, so that we call it like you've heard it maybe called an abdominal separation,
Mm-hmm.
but it's just that tension. So sometimes there's a little bit of a gap, sometimes there's a little gap, and there's not as much integrity to that that fascia as we really, really want.
Okay.
So I'm gonna check to see what's going on.
Okay.
Okay?
Yep.
Do you mind if I put this up a
I
little
do
bit?
not mind.
Okay.
Do what you need to do. Use me however.
Okay. So I'm just feeling for some tension. How it is when you lie down. And sometimes if you have pelvic floor stuff or lower back pain, it can be connected to the fact that you have a diastasis.
Okay.
It's not always the case, but if you do,
Yeah.
it would tell us a lot that your core is just not functioning.
The way it should be.
Yeah.
Okay.
There's a lot of different issues going on. Okay, so now I'm gonna ask you just to kind of give me like a crunch. So you're gonna reach towards and keep your, yeah, perfect. You can actually put your foot down. So immediately I don't see anything, like usually if there's something going on, there's like a coning or something
Okay.
popping out. I don't see that, but I'm gonna palpate to see. So do you feel that ridge there?
Yeah.
That's what I'm talking about. And you see how it gets a little bit deeper here?
Mm-hmm.
That's your diastasis, and it's not bad. It's deep,
Mm-hmm.
but it's not wide. Yeah, and then it kind of, do you feel that it's less here?
Yeah.
So you
So
do
it's
have
really
one,
there.
but it's not bad. And for a lady that's had 2 babies, this is pretty normal.
Okay.
I would say that there's tension there. It could be a little bit better. If you can see, I can put,
Like, yeah.
I can go right in,
Yeah.
right?
Yeah.
So what I would say is that that's probably, it might be contributing, it might not. So you can come down and relax. If you want to, you can feel it for yourself if you want.
No, I could feel, I could totally feel when you were doing it.
Yeah, does that all make sense?
Yeah, yeah.
So generally when you had a baby, I mean around the belly button, that's where you get it. It's either widest or it's deepest, and that's what I saw for you.
Okay.
That's something that as a trainer, if we move forward, like, you know, I would be aware of, and I would probably give you specific things to crunches may not be the best thing for you right now in terms of like rehabbing all of that, until we kind of address that that lack of tension there.
Okay.
Does that all make sense?
That totally does. Nobody's ever done that for me before.
Yeah. Yeah, which is crazy to me.
I know.
Which we should all be checked. We should all. There are some European countries where you have to see a pelvic physio afterwards. You have to be checked, and it's not necessarily about you not doing what you're supposed to be doing. It's like you're not knowing what you're
You just
supposed
don't
to.
know.
Yeah, and you've been walking around in pain and leaking and all of this stuff for no reason.
I know. Great.
Not for no reason, but like.
No, but I know what you mean. Like.